Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, once a week, we bring to you news and views about infectious diseases, vaccines, and vaccination. I am Schmitt, and with me, as always, is Dr. Melvin Sanicas. Good morning to Switzerland. Good morning, Melvin.
Good morning, Professor Schmidt, and good morning, good afternoon, good evening to those who are watching us or listening to us today.
We have exciting topics today, and that covers avian flu in the United States, the WHO definition of what is airborne, on lower respiratory tract infections and global health. We report about an increased number of cases of psittacosis in Argentina. Physical activity reduces CVD risk, and then we are looking for collaborators in Asia on a health literacy website. Without any delay, let's start with avian flu. And actually, this is a WHO report you can find on their website. There is now a second case of laboratory-confirmed human infection with an influenza A H5N1 virus from April 1st, 2024. And this was actually detected in Texas in the United States. The patient had developed symptoms in March, and now this is the second confirmed case of AH5N1 in the country. And the question is that of any concern? Well, the WHO says, similar to the Centers of Disease Control, that the virus has not yet acquired mutations that allow transmission among humans. So right now, the two cases are from cattle to dairy farmers, to close contact persons, to animals who had come down with AH5N1. So they think overall, the rate or the risk for a pandemic with AH5N1 is currently low. But for occupationally exposed person, like the two cases that were reported, the risk of infection is considered low to moderate. This is the WHO report from early April, and this is actually, I just checked it before we went online. It is the last update is from yesterday from the CDC, and again, they confirm that H5N1 is widespread in wild birds worldwide, causing outbreaks in poultry and dairy cows in the United States, and again, these two cases in the United States. They consider the health risk to be low, but they are monitoring the situation. And on the map, you see Texas here. All over Texas, everything is blue, right? All of Texas, but it is two cases, right? So this is the situation. Melvin, any views?
Yeah, so this has been going on for some time now. And the latest in the US is that they have seen particles of the virus in commercially available milk. So I think what they're trying to say is at the moment, they think that the milk supply is still safe, even though some of them have been tested and they had particles of H5N1. But we will see, right? We will see what is happening because I know from other viruses, if you pasteurize milk, they will be safe, right? I would imagine that it's the same for this H5N1 influenza virus.
Yeah. So we keep you posted on that. I think this is quite exciting. We just recovered from a pandemic, and it would be awful to have a next one. And I talked to a couple of manufacturers recently if they're ready for H5N1. And my impression is they are ready and they are preparing for a pandemic situation. Hopefully it will not come. Hopefully it will disappear as it did. Yeah. Interesting. And again, we will keep you posted on that. Now I have another story from April from WHO. They had a meeting on the terminology for pathogens that are transmitted through the air. I was not part of the consultation. I'm just a retired expert, right? Nobody's asking us, but look, this is what they came up with in their consultations. Individuals infected via the respiratory route can generate and expel infectious particles. And then they describe how that can happen. And they claim that these particles should be named infectious respiratory particles, or IRPs. What they changed now is they no longer want us to consider small and large particles, which from a physical point of view is sort of not really easy to understand why they did this. And look, I did my professor thesis after the PhD on aerosolized amphotericin and on aspergillosis, on respiratory pathogens. And I very well know that different sized particles have different abilities to reach the lower airways. In any event, they no longer want us to distinguish between larger and smaller particles, which may, from an epidemiological point of view, be the right way to look at it, but physically, I would not really understand this. And again, what they came up with then is that they have now airborne transmission or inhalation. This is defined. And then there is the definition of direct deposition of these IRPs, and they can be directly deposed in mouth, nose, eyes of another person nearby and then enter the respiratory system. I'm not quite sure what this all means, but for difficult questions, I have Melvin with me. Melvin, what is your view on this here?
No, I think one thing, Professor, I have to say that it's a good thing that they had this meeting, because many of the confusion early on in the pandemic in 2020 was really because of the definition of what is airborne and what is not airborne, those droplets and what is not considered a droplet. And basically, one thing that is true is that we know that these IRPs, no matter how small they are, if they can infect, they can infect, right? They're infective. But
Yeah.
then I would imagine, like what you said, that the smaller ones could really actually go to the smaller size bronchioles, and they could go further down the lungs. And of course, it makes sense from a physics point of view, right? That they would really go down there and create some infection. But then again, I think, one thing that we should just remember is that with COVID, we knew more about respiratory viruses, and we're still knowing more about them. And I think this should be considered a living document where it can be um, revised as often as we see new data that's coming from real and robust scientific evidence.
If any of our audience has some idea to explain this further to us, I would be very happy to talk on it again next week or any of the following weeks. You'll find my email in the end of our session today. Then I have a piece of good news, and lower respiratory tract infection mortality rates have really gone down. And what you see on the top line is by age group, the incidence of deaths per 100,000. And you see here from 1990 to 2021, the death toll in children under 5 years dramatically dropped from like 300 to less than 100 per 100,000. So this is really, really good news. And the same is true if you look at the death count here. There isn't much of disease in the Middle Ages from 5 to, let's say, 70 years. And again, as of 70 years, there is a drop, and there's also a drop if you look generally in all ages. I guess this little blip here, that is due to COVID in 2020 and 2021, I would assume. So overall, very good news, and it is a very long, but a very interesting article full of detailed information. And what I want to show you a little bit more is the pathogens. What is really striking is the pneumococcus here in violet on the top of each bar. That is still a leading cause of death in any age group. And this is really, really amazing. Again, for those age 5 to, let's say, 50 years or maybe even 69, up to 50 years, it is not really that relevant. You saw that in the previous slide. But then the pneumococcus is really something that is vaccine preventable these days. And then if you look at Streptococcus pneumonia was here, then look at Staphylococcus aureus. This is really something that is really large proportion, particularly at the number of deaths in the elderly. And then if you look at influenza, this is the green part here, it is not that prominent, right? It is not as prominent as the pneumococcus. There is now evidence that respiratory viruses like influenza and RSV are the prerequisite for a bacterial pneumonia. And if that holds true in all age groups, then preventing influenza and other viral infections of the lower respiratory tract may really be the way forward to reduce this picture. And again, here is what we die from. The myocardial infarction is on many death certificates, but I think the final cause of death very often is an infectious disease. And this is just again to look at the pathogens. 1990, strep pneumonia. 2019, strep pneumonia. 2020, strep pneumonia. 2021, strep pneumonia. And then S. aureus has become the number 2. Several companies have tried a vaccine against Staphylococcus aureus, and none of them worked so far. I think what you need to prevent Staphylococcus aureus infection is granulocytes. You need phagocytic capacity, and that is what is missing in the old age groups and maybe in the very young. And this is why we see Staph aureus so prominent here as the number 2. Melvin, any views from your side on this data from this huge publication?
Well, just to add to what you said about the need for having granulocytes, and I think we just have to accept that that's nature, right? The too young and the too old who don't have as much granulocytes as the younger generation. So I guess maybe there are ways to protect them from Staph aureus that does not involve a vaccine. Maybe that's one thing that we can admit, right, scientifically.
Yeah. Yeah, and that is also something you worry about if there is a pandemic. And the first worry that I would have is it is a non-cultural organism. If you cannot culture it, it is very difficult to study. It is very difficult to define what is a case, and it is very difficult to develop therapy and vaccines. The second thing that I worry about is that a vaccine won't work because you don't need antibodies, but maybe you need complement or you need granulocytes or a specific subset of immune cells that you cannot generate with a vaccine in normal general terms. In any event, I think it is a nice exercise here to look at the hit list of pathogens that we die from. All right, Melvin, this is yours.
Yeah, so this is just basically a review of what we discussed a few months ago about the cluster of pneumonia in European countries. Basically, it was in February 2024 that Austria, Denmark, Germany, Sweden, and the Netherlands reported an increase in psittacosis in 2023 and also in the beginning of 2024. And 5 deaths were even reported in Europe. And this was largely because of exposure to wild and or domestic birds reported in most of these cases. And as we know, psittacosis is a respiratory infection caused by Chlamydophila psittaci or C. psittaci, a bacteria that often infects birds. And it is known to be the parrot pneumonia or other names, but it's a bacteria that does not infect only parrots. So let's just say that up front. And now we have this new set of cases in Argentina. They reported severe pneumonia, and it has been linked to a rise in psittacosis. And this was announced a few weeks ago. And the infections were mainly reported in the Buenos Aires metropolitan area. And they were looking at the cases. They said that there were no subtypable influenza A viruses found, and there were no unusual respiratory viruses found in those cases, and they only found psittacosis. So it's safe to assume that this is definitely the cause of those pneumonia. And they also checked whether there was mycoplasma pneumonia or chlamydia pneumonia, but they were not found in those cases. So I think it is not surprising to see these cases in other countries in Latin America as well.
This is a treatable disease. The issue is you have to know that it's psittacosis. Otherwise, you would choose a different antibiotic, right? You probably would use doxycycline here, which is the cheapest option, I guess, for treating this. There is no case of human-to-human transmission, right? So each case is linked to birds.
Birds, yeah.
Yeah. All right. I'm not sure. I have here my office on the fourth floor of a very nice building, and there are always these birds out there that I look at. I keep the doors closed, so you will see me again next week, and I won't get sick with psittacosis. But so this is something very nice that you found for us, physical activity and the heart, coronary vascular disease. What is the story here?
This is related to basically a series of all these reports we have about the value of physical exercise, right? We have started this when we were discussing COVID. We were saying that physical exercise is really helping COVID patients recover, really helping patients who exercise not die from COVID. We've also mentioned that exercise is good for the mental health. And now we are seeing in this new study, which actually looked at the effect of exercise um, on the cardiovascular disease and basically looking at stress-related neural activity, which is known to potentiate cardiovascular diseases and also known to have some role in anxiety and depression. And I think in this study, of 50,000, over 50,000 adults, we clearly see that exercise has a role to play in really helping the body deal with stress-related activity and also with depression. So I think this is good news. And I think it really just means that we should all try to do some physical activities every day.
Very important message. So my question to you is, what are you doing every day to keep you healthy and to prevent you from getting coronary vascular diseases? What are you doing?
Yeah, so I walk every day. I walk 10,000 steps at least, 10,000 steps at least every week, every day. And on the weekend, I even walk more. So, of course, there are a lot of lakes and mountains and hills and very nice spots for enjoying nature in Switzerland. And that's what I do every day. I walk and just look at the water, look at the swans. And for me, that's the way for me to relax and also get my steps.
Yeah, sounds like fun. For me, it is hard to believe. Ever since I retired 3 years ago, I go to the gym basically every day. It doesn't work every day, but 6 out of 7 days it works. And I'm on a stepper, or alternatively, I am doing what is called exercising, light workout, I guess is the right term for that, right? Being on all these different types of machines that are working for different muscles of my body. So that is what I am doing, and I really have to say it is no fun. The one thing that is fun though is I listen to some blogs and you understand something from the news or from some science pieces. That is the fun part of it. But I'm very honest. I don't like it too much to spend an hour each day in the gym, right? Or getting ready for the gym and then being there. Anyway, I guess I force myself to get it done, and maybe you have more fun with walking.
Yeah, walking is different because you get to see people, you get to see many more things. And I also listen to whatever, like you, right? I listen to music, I listen to blogs, I listen to people arguing online. So, I think it's good.
Yeah, very nice. And with that, I just want to highlight that we are looking for collaborators. Global Health Plus has a website called Health Literacy Asia. It is a little bit focused on COVID-19. This is the link to the website. You will find it in the show notes. We already have these websites for Pakistan, for Malaysia, and for Vietnam. And if you want to be part of that, particularly if you live in Indonesia, Taiwan, Hong Kong, or Singapore, or maybe another Asian country, contact me. You see my email down here on the left side. I would be very pleased to receive your input, number one, on what is an airborne disease and why did WHO change the definition and what does it mean? And also on this program here. We even pay a little bit of money for those who help us. We're looking specifically for public health institutions that already may have an own website and who would like us to support them with information that is from their own country for a wider audience of lay public people in their country. Having said this, Melvin, any other last words from your side?
No, just again to reiterate, right? So those who are watching us from Indonesia, Singapore, Taiwan, Hong Kong, these are the
Thank you.
countries that we are looking for partners for this Health Literacy Asia COVID-19 project.
Very good. And that ends our call for today. And we spoke about avian flu in the United States, 2 cases so far in humans, no human-to-human spread yet. We looked at the WHO definition of airborne, which is all new. We looked at lower respiratory tract infection and deaths, and the good news is deaths went down, death incidences went down over the last 30 years. Melvin presented psittacosis in Europe and Argentina. Physical activity reduces the cardiovascular disease risk. And again, we are looking for collaborators. Please feel free to contact us. Thank you very much for listening to us today. You will find all the slides in our show notes. Thank you and goodbye.
Thank you, everyone. Stay safe.